It is 5:41, and treatment-resistant depression and PTSD are two disorders that people are finally beginning to open up and talk about. Our Brooke Slyer is live in Carbondale this morning at a recently opened clinic offering treatment for those disorders. Brooke?
Good morning, Dave. Well, this clinic is a great option for veterans who are suffering from that type of depression, and PTSD. And joining me again this morning is Dr. Mark Garwin, who opened up this Albany clinic. So we're going to talk about two treatments this morning. And the first one that we're going to talk about might be surprising to some folks at home, and that's talking about a ketamine drip treatment. So if you can go ahead and fill us in of why ketamine, how does this help?
So ketamine is an anesthetic agent. It was developed in the 1960s specifically for combat circumstance. It is what can be described as a dissociative drug. People do not perceive pain, but it also preserves cardiac function, respiratory function. The problem with ketamine in the field is if you use enough medication as an anesthetic, people have bad dreams when they wake up from ketamine. So in the 1990s, when PTSD was a significant issue, there was a question about whether patients who received ketamine also had a higher incidence of PTSD. And the studies actually showed that soldiers who received ketamine in the field had a lower incidence of PTSD. That led to research about ketamine. And it turns out that ketamine is a rapid-acting antidepressant, and it does not promote PTSD. It actually helps treat PTSD.
And so for those who come here to get that type of treatment, how long does the treatment usually last for them? Is it a couple of weeks, a couple of months?
Well, I tell all the patients, everybody is different. There are some patients where I could do one IV drug infusion therapy and they're good to go. Most patients will require at least 2 to 3 on average over a period of time. Over half of the patients will need 6, but that's spread out over a period of time. Most patients, having had 2 or 3, will go home and not come back to the clinic unless they need something. And we do what we call maintenance doses.
Well, we're going to talk about the other treatment coming up on a little bit later on in the show, and just ways that people can find out more about this clinic again later on in the show. But for now, Nick, I'm going to go ahead and toss it over to you with a look at today's weather.
Yeah, Thursday morning.